Hi, everybody. This is Dr. Tao Chiang from Taiwan. I'm the director of Biomate IAI. And today I'm going to present how to use the Biomate implant correctly. Nowadays, we know implant is just a routine work in the dental clinic. For example, if we pull out the tooth and wait for the healing to about 2 to 4 months, once the bone healed to the certain extent, then we can start to drill the bone and put the implant in. Wait for the other 2 to 4 months, and we started ready for loading. It's simple and straightforward. And however, this all procedures talk about in the regular bone. However, in the most of the situations, we will face some difficulties. For example, the bone structure like this. This poor quality bone, that will make implant very, very difficult. So for Biomate, we designed the implants to provide a better environment for bone healings. From surface treatment to thread design, there are many differences from the traditional implants. That's why we need to pay more attention to how to use the Biomate implant correctly in order to achieve the purpose of improving the bone healings. If we don't pay attention to these details, we might face some problems. We might not have the proper bone healings. Further, we even cause more serious bone resorption in the early healing period. So today, I'm going to briefly introduce our implant, the Biomate implant, and also the important thing is that how to correctly use our implant. For implant, Biomate II core technique is the PDL laser. So-called PDL laser is a precision dimension laser. That's a special laser treatment to roughen the implant surface. And for laser treatment, this is a very, very clean procedures compared to the traditional implant roughening. For example, the SLA. For SLA, that we always have the residue of the silica. And for thionite treatment, we always have the phosphorus and the sulfur. That's from the electrolyte solutions. So it's very difficult to achieve the very clean surface. However, laser treatment on the left of these pictures, for example, in the left, we see that we only found an element of titanium, nitrogen oxide, and carbon. That's all from the implant or the environment, and no any residue from the processing. So that's why we got a very clean surface. And this laser treated surface, we create a micro channel with the nanostructure on the surface that can improve the osteoblast and the endothelium cell attached on the surface. So that means we can benefit for the new bone formation and the new blood vessel formation. And we can compare the cell to grow on our surface to the SLA and the metal surface. We found at the same time procedures, and we found we have much more cells growing on the surface. And because of the laser treatment, the surface structure is very sturdy. That means during the insertion of this implant, no matter what we do for the implant, for example, the insertion in the little bit higher torque, or we have to retrieve and reinsert the implant, the surface still retained intact. However, if we do the same procedure for the SLA, sometimes will ruin the surface structure. So for this implant, we have to know that we have very, very sturdy surface. And also important, the other important features of our implant is the thread design. We have very, very unique trapezoidal thread design. This design can offer a maximum bone to implant contact, and also can stabilize the implant inside the bone. More importantly, that can decrease the stress. We see the trapezoidal implant thread that can have much less stress on the bone, especially in the cortical bone area. That we can see it's much lower compared to the square or any triangular thread design. And this trapezoidal thread design can offer the large bone implant contact and decrease the stress on the surface and have a very, very good bone preservation. Combined with the PDL, that can really benefit for the new bone formation after the implant being inserted. And also this trapezoidal thread design, take our Biomate Plus implant, for example, the 4 by 12 millimeter implant, we have the surface area about 237 compared to the other brand. With the similar sized implants, we found we have much higher surface area. So that means we can allow much more bone to grow on the surface. At the same time, that means if we don't do things properly, this thread design and the large surface area will increase a lot of frictions on the surface. So we have to pay attention to these features. So when we do the implant, we have to control the torque very, very cautiously. If you don't do that, we might face a lot of problem. With the reasonable stress, for example, if we have the torque reach to 35 newtons, that's good enough to have the initial stability. So initial stability is important. However, we don't want to introduce too much stress and decrease the blood supply and cause too much bone resorptions on the surface. And once we do that, we can see the new bone formation will keep the fixation of the bone on the surface that can increase the torque constantly compared to the traditional implant who always sees the drop of the torque. So if we know this phenomenon, we know that if we do the things right to our implant, we can really achieve the good bone formation in the future. And also that for the torque control, we know that a lot of dentists may believe that the protocol to tighten the implant within the bone to 45 to 60 newtons, that can increase the initial stability. However, on the other hand, on the contrary, the additional torque might cause more trauma on the surface that decrease the stability due to some resorption might happen later on. So that's why we don't want to introduce too much torque to our implant. For the Biomate implant, we can see this. This is a Biomate system implant. You can see that even in a very loose bone, like this situation, almost to the D4 bone condition. And this implant, when we insert that in, you can see 3 months, 6 months later, we can really see the bone formation on the surface. That means if we can have a reasonable initial stability and a good bone, good blood supply, we can expect the good bone healing in the future. Take this one, for example, originally it's a very, very thin bone, about 1 millimeters. And if we do things right, with a very, very little amount of bone graft, we can expect in 3 months, 5 months, even 7 months later, we can see the bone grow on the surface compared to the original. In 7 months, 8 months, we can have a very, very reasonable and good quality bone around. So we really don't need that much initial stability. We need the blood supply and the environment for the new bone formation. And how the bone really grow on the surface, on this unique laser-treated surface. This is a patient, and the implant is about 2 years old. However, this patient has suffered from the traffic accident, and you can see the center screw be broken. So that means we have to remove this implant. So we use the piezo surgical to remove the implant, and use this implant we can survey how the bone grow on the surface. We can see on the thread area, we can see a lot of cell-like structure or the soft tissue-like, the collagen-like structure within the microchannel. Oh, okay. And we in the close-up view can see more features that within the microchannel. We can see a lot of collagen-like and cell-like structures within the microchannel. However, to survey the bone between the thread, we can really see how the bone grow in this area. Distinctly, we can see 4 layers on top of the implant. The first layer is the basal layer. That's the structure we describe within the microchannel. Okay, and then we can see the intermediate layer. That's the initial calcified layer, and the soft calcified layer and the matured calcified layer. All these 4 layers are organized and tightly integrated above the implant surface. So that means this bone structure is quite firm on the surface. And we can see all these layers be tightly connected with collagen-like structures. So all these structures tightly united together. We can see the basal layer, intermediate layer, even the soft calcified layer. We can always see this structure be connected. And for the electron microscope surveying, we know that we need a very dried samples. During the dry up, we might create some lacerations. However, even we see the laceration, we still see the basal layer is very, very tightly attached on the microchannel structure. We can see that all these basal layers is firmly attached to the microchannel. It's very similar to the velcro fastener the fastener. That means all these layers are tightly attached on the surface. Compared to the SLA, that's the other failure case, we retrieve the same way. However, we see on the interface, there are not too much collagen layers on the surface. And also in some area, we can see the totally separation of the bone from the implant surface, like this. And this phenomenon is very similar to the published paper talk about the peri-implant endoosseous healings. That claim that collagen can be seen to be distinct from the interfacial matrix that separates the collagen from the implant surface. So compared to those SLA or other surface, the the PDL surface bone formation is really tight, very tightly integrated into the bone is tightly integrated into the implant structure. So compared to the traditional implant, to the natured tooth structure, we know that the implant is tightly contact the bone is tightly contact the bone. There's no any special structure between the bone and the implant on the surface. However, for the tooth, that we can see the PDL, periodontal ligament, with the abundance of blood supply and the collagen, connect the bone and the tooth together. So that means the difference between these two structures, once we have some destruction or anything happen to the bone, we have the very high chance to reheal the bone. However, for implant, it's very difficult because it's short of blood supply in this area. However, for the PDL treated surface implant, we found that on the surface, because we have the microchannel with the nanostructure, and this structure is benefit for the osteoblast and the endothelium cell to grow. That means a lot of new bone formation with the blood vessels on the interface. Plus, the microchannel per se is a good environment for the substance to be transported within this microchannel. So that means the PDL structure on the implant surface can at least partially compensate the PDL of the nature tooth. So our PDL, the laser treated surface, the microchannel, can create an environment to partially to partially mimic the periodontal ligament structured on the nature tooth environment. So for our implant, if the implant properly inserted into the bone, and no matter what kind of density, even though in a very low density bone, that we have a very good chance to have the bone healed. Even associated with the bone graft, we can see the bone graft and the implant can also be healed very well. And this is the implant combine the particulate bone, and we see the contact area. Within 1 to 2 months, we start seeing the new bone formation. Okay, about 4 months and 5 months, the mature bone on the surface can be seen. Even in a very poor quality bone like this, we can always expect the good result. Okay, similar phenomenon here, that we start with a very poor bone structure, and then 2 months later we can see the bone start formed on the surface. Now, even in the neck area, if it's short of bone in the early stage, we can see the bone grow back on the surface like this here. We always see that the healing can be happened within few months. So if we look at the natural tooth and the bone relationship, we know, especially in the anterior front teeth, upper front teeth, the labial plate is very thin in some cases. So a lot of biting force on this area might cause some blood supply problem and also the stress concentration. So we always see the fenestration in this area, especially in the Asian people. So that's difficult for the bone grow in this area. So we were seeing the similar thing happen to the implant. If we short off bone in this area, we will see the the implant will end up with this situation. So the implant, if we don't have the proper location or proper blood supply, we might end up with short of bone in the labial surface. However, PDL treated surface, we have the good bone supplied plus the microchannel per se. That we can offer the better environment for the new bone formation. So we might have a higher chance to go this way. That means in this situation, we have a higher chance to have the bone grow back in this area. This is very easily to be seen in the Biomate cases. This is the case we showed before. For the very, very poor bone situation, we have the very high chance to get the bone formed. Last but not the least, recently we found the laser-treated surface can offer the very good environment to inhibit the biofilm formation. That's a surprise news for us because in the original we always thought about the blood cell or the osteoblast cell to grow on the surface. We never thought that this laser treated can inhibit the biofilm formation. We know the biofilm is the biggest enemy for implant that will cause the severe peri-implantitis. That's why for the roughened surface, no matter what, it's from the SLA or other treatment. Once the surface be roughened, it's very easy to have the biofilm formed. So that's why we need the polished surface on the top to prevent the bacterial invasion. Because compared to the biofilm prevention, that polished or machined surface can have much less biofilm than the roughened surface. However, if we look at the laser treated, the second bar is our Biomate PDL treated surface. You can see the biofilm is much less, even much less than compared to the polished surface. So our laser treated per se is the self-existing bacterial resistance phenomenon. That means we can really protect this area being attacked by the bacteria, and especially if we blow up these pictures, we found on the left that's the biofilm grow on the regular sandblast surface. You can see layers of biofilm be formed on the surface. However, on the laser-treated surface, the bacteria is very, very difficult to grow in the pit or the deeper area of the laser-treated surface. So that's the reason it can inhibit the bone. The bone be attacked by the bacteria. So the biofilm is so difficult to grow on this surface. Maybe you will raise the question: why don't we just make all the surface like this that can get rid of the biofilm formation on the surface? However, we need the nanostructure for the osteoblast or the endothelium cell to grow. So that's the reason we need this structure. That also means if we really face the problem of the peri-implantitis for the Biomate implant, we only need to clean up this area easily. That because we only need to clean up this area, then we can totally remove the biofilm that we can recreate the environment for the new bone formation. So to conclude the unique features of a Biomate implant, initial stability is important. However, blood supply is vital. That means for our PDL plus the thread design, we only need the reasonable amount of torque to stabilize the implant. And the PDL and also the thread can provide a good environment for new bone formation. And we don't need too much stress. So for some implant that they claim they have the self-tap uh, phenomenon, that we can use the self-tapping benefit to tap the implant in. However, that tap might introduce too much stress on the surface. The surface is sturdy, and this surface can enhance the osteointegration. No, and the 5 to 7 points, that means we have very clean and we have anti biofilm formation phenomena. That means we have a better chance to survive in the bone. However, this implant is not 100% perfect. Sometimes we will face the problem. For example, in a very, very dense bone, if we really introduce too much stress, for example, this case, because we did not really position the implant correctly, because of the bone is too dense, we use too much torque, and we still cannot really properly insert in the implant. However, 1 month later, we can see the bone resorption happening around this area. Most of this reason, the reason for bone destruction, is because of too much stress around the implant. So to decrease the surgical trauma and the amount of initial bone remodeling, that's the important thing to consider about the implant placement. And the other important feature is that we have to control the temperatures. We know that if the bone temperature above 40 degrees Celsius, we have the chance to start the bone cell dying. That means the bone will start dying above the 40 degrees Celsius. And once we drill the bone, if we raise the temperature up to 41 degrees centigrade, we required more than 30 seconds to 1 minute to cool down this area. So that means the proper drilling protocol is important. We don't need to jump to the final drill too quickly. We have to do that step by step. And every drill, when we drill in, we need to do the in and out motion to give enough water into that area to cool down the temperature, and also to introduce enough lubricant inside that area. And also the torque control, as we mentioned before, too much stress will cause more bone death. And the most important thing is that a self-tapping implant may cause greater bone remodeling. This remodeling means damaged, compared with the bone tap first, then implant placement. So with all these thoughts in mind, that we have to control the bone, environment bone, to the minimal amount of microstrand, that this microstrand can benefit for the bone remodeling, the new bone formation. If too much strand on the surface, that will kill the bone. So how to correct use of our implant? Most important thing is to control the torque. When we set up the implant machine, we need to have all these parameters in mind. For drilling per se, that 20 newtons with higher speed, for example, 1,200, 800 to 1,200 is plenty to prepare the bone, especially to start with the thinner drill, that we can have the higher speed. However, with the thicker, especially for the final drill, we have to slow it down the rotation to 800. Okay, but the Newton, the torque wise, 20 is important to set up. Never uh, never go up to 20 when we drill the bone. For tapping, because we will face much higher friction, so we can set up to 30 newtons with the speed about 35 to 40. And for insertion, that 35 newton is plenty. Never set up your machine above the 35. Okay. And for the heating abutment or gingival former or cover screw, important thing is that for this step, 10 to 15 newton is plenty. Okay, for the final center screw, 30 newton is plenty. So that means if we do all these procedures, torque, this is very, very important parameters to control. If we go over that, we will introduce too much stress onto the bone, surrounding bone. And the other thing is that appreciate the dimension of the implants and drills. The drill protocol, important thing is to prepare the implant site for implant. Then the term of the final drill is the last drill for prepare to drill the bone. However, the size is the size of the internal diameter of this implant. Don't think that with the final drill that we can insert the implant. Definitely that will create too much stress. So for tap, that's the size of the outer surface of the body of the implant. And the countersink is the size of the profile of the implant. So for the Biomate system, if we have this shape of implant, we have to prepare accordingly. That means after the final drill, we have to prep with the countersink, tap, then put the implant. Don't jump this step. If we jump, we might introduce too much stress. For the Biomate Plus system, the similar thing is that the final drill size is about the size for the inner parameters, inner the diameters for implant body, and the tap is the outer diameter, and the profile is the size of the crest module. So for denser bone, D1 and D2, we have to follow this sequence. Don't jump. Okay, if you jump, you will end up with too much stress. So for D1 bone, tap is more important. If we skip this, we will have the problem. So if we in a dense D2 or D1 bone situation, if the first time it's hard to have the whole implant in, we have to consider the other way to properly insert the implant. We'll discuss about that very soon. If we found the implant machine 35 newtons setup cannot have the full implant in, we have to use the hand wrench to do that. And never, if we found even over the 45 newtons still cannot get the implant in, we just judge how far away from the totally positioned the implant. If that's only have 1 or 2 millimeters away, maybe you can think about that. Just reverse the implant 1 or 2 turns and then redo the implant, reinsert the implant, and then use that, we use the hand range, we can set up the range to the infinity. That means we can use the higher force uh, to insert implant again, to turn it clockwise 3-4 times. This way, when we reverse the implant, we can decrease hydraulic pressure and let the hydraulic pressure down. They can reinsert the implant. When we do that 2 or 3 times, and then the implant is in, that's fine. But if we still cannot get the implant in, or the implant is too far away, about maybe 1/3 away from the totally in that situation, it's better to retrieve the implant and reprep the surface. It's always happened in the hardened bone. In this situation, if we use too much force, again, we might have the higher chance to have the bone resorption. So follow this. We always have the proper positioning of the implant. And if we do everything right according to the mark of our drill, and for example, if we want to drill the 10 millimeters implant in, we drill the mark to the 10 millimeters. Always we will get to 0.5 to 1 millimeters that deeper bone prepare. Okay, so in that chance, we can have the bone totally insert about 0.5 to 1 millimeters subcrystal. So that is the best position for the bone, for the implant into the bone. If we can have the bone properly placed in this area, definitely we can have a good environment for the bone formation and prevent the bacterial invasion into the bone area, the implant area. If we found the bone resorption in the follow-up session, okay, one thing is that double check what really happened. If we can be properly sure that we have no sign of infection. Most of the time, it's due to too much stress when we place the implant. Because no infection in our implant can have the good chance to have the bone grow back future. We will show some cases later on. But if the really got infected, the best thing is that to control the infection. Sometimes we just do the regular way to clean up that area with the antibiotics irrigation, and have the patient to take some antibiotics. Sometimes we have to reopen that area, clean with the laser, and sometimes we need to put the bone graft in to rescue the implant. Of course, retreat is the last option for the redo the implant. So really depends. The only points I want to raise is that if no infection, we can have a very good chance to wait and see. Sometimes we will get some very good result. Take this case, for example, when we insert that, we've insert that the bone level is okay. But few months later, when we do the impression, we found the bone resorption. However, 4 more months later, we found the bone grow back. Here, compared to the bone resorption and the bone grow back. And this case we follow up for 9 years. We can see that within 2 or 3 years, we found the bone resorption. However, few years later, the bone grow back. Important thing is that in this situation, we have to be ensured there's no sign of infection. If we see the pus, we see the swelling, we see the plaque formation in this area, of course, we need to do something else. If not, just wait and see. And take this case, for example. This always happens in the very, very dense bone. It's more like a D1 bone. When we have the implant in, we see the resorption in the beginning. However, later on, we see the bone grow back. And here is the bone cover is much better than the original. This also the similar thing in the very dense bone. If we don't do things properly, we might see some resorption happening. However, we have very high chance to have the bone grow back. But if we do things correctly, even the dense bone like this, when we insert the bone, we can see little amount of bone in this area. However, 6 months later, we can see a lot of bone grow back. Because of our thread design and the PDL surfaces, we have good chance to help the bone grow. So to conclude my presentation, how to correct use our Biomed implant. First, most important thing is the torque control. Okay, and always follow the drill protocol properly. Okay, including the drilling per se and also the implant placement. That's important. And torque control is important. If we sometimes we have the too dense bone, we can when we have the problem to insert the implant, as I said, sometimes we need to reverse and then turn the to reinsert the implant. This back and forth several times. We have the chance to have the implant in, or just take the implant out and then re-prep the implant site and put the implant in. Important thing is that, again, the torque control. And for implant, as I mentioned before, the laser treated surface is very sturdy. Even we insert and reverse and turn again, the surface still very sound. That means still very good for the bone healing. So don't worry about this part. The important part is the torque control. Properly position the implant, okay, is also important. And once we have the problem of the bone resorption, don't be panic. If there's no infection and the patient can do the infection control well at home, we can just wait and see. Okay. But if we see the biofilm, we see the pus, we see a lot of swelling. Sometimes, judging from the X-ray, we have some bone loss within maybe 1/3 of the implant. We have the chance just open, flap, and clean up with a laser and put the bone particulate and just like a fresh implant, we can still have the very high chance to have the bone grow back. And if the situation is even worse, up to 1/2 of the implant bone have to got the bone loss, it's better to remove the bone. Remove the implant and redo the implantation. Sometimes, of course, we have to wait for the bone heal. Okay, so that's the introduction for today. I hope that can give you the good information, the idea how to correctly use our Biomed implant. And also, if you are interested to our Biomed implant, especially the very unique surface treatment, the laser treatment, we will have the other session to go to the detail about this. We have plenty of research to relate to all these phenomena, how it can help the calcification, how it can help the cell attach, how can it help the new blood vessel formation, and so on and so forth. We have all the research relate to those. And also the thread design, and also a lot of papers mentioned about our thread design, like a trapezoidal thread. That also good for the bone heal. For this, we have the other sessions to go for the detail. So if you are really interested, you can contact us. So thank you today for listening, and hope that can help you to have the good result of your implant day. Thank you very much.